Morning everyone, and today this week our next topic which we are going to finish is called as Echinococcus granulosus. This is the name of the parasite, and the disease is called as Hydatid disease. By the way, this is not the only disease it causes, rather there are many other names, of the same condition, which I will be talking now. So the parasite which we are studying is called as Echinococcus granulosus, right? So of course, like Echinococcus granulosus, it is the full name, and this Echinococcus, it is the cystode, okay? Uh, Echinococcus granu, uh, granulosus, right? So this is the full name. So Echinococcus granulosus, basically, it is a genus called as Echinococcus. It is a cystode, and or you can say flatworm, right? So it have a lot of types like Echinococcus granulosus, which we are going to study now. There is also called as multilocularis. Not so important. Like I'm going to teach you the important one only. Now, the disease which this organism cause is called as Hydatid cyst. So it cause there are different names for that thing. One of the name I told you, Hydatid disease, right? Don't get confused if you will found somewhere written as Hydatid doses, same thing. Or don't confuse if you found somewhere written as echino echinococcosis. Okay, so they are the name of the same condition, guys. So this is like all are the name of the same thing. So as you can see that it causes hydatid cyst. Okay, so simply it's a cyst forming disease, and again you could say a cyst forming disease. Okay, which causes form cyst. It is caused when there is infection with metacystode, or you can say like this is the other name for the larval stage. Okay, larval stage of this organism. So five species have been characterized until to date until today, and the vast majority of the human disease are from Echinococcus and Echinococcus granulosus and Echinococcus multilocularis, right? So both of them they causes cystic disease or cystic echinococcosis, right? So again, if you will found this thing, so again they refer to the same thing, and millions of the people worldwide they are affected by this one or by human hydatid disease. Uh, so that's the reason, like the diagnosis, the treatment, the prevention of this disease has become a serious concern for public healthcare system around the world. So I always tell you the importance of anything before, right? So that you would know like why we are studying this condition. So now, uh, one of the thing, guys, as you know, we know that there is a pork tapeworm. We know that there is a beef tapeworm. So maybe you will be surprised by knowing that this is also called as dog tapeworm. Okay. So of course, like as if you know, like it is dog is there, so for sure the dogs are playing some role in this one. And to talk about like the importance, as I told you, that echinococcus infections they are estimated to affect you can say 2 to 3 million people worldwide, and this condition is endemic in some of the regions, so like North and South America, Europe, Africa, and Asia, simply where the livestock is too much. So this condition is too much over there. So now the adult form of this one again lives in the jejunum and the duodenum of the dogs, and also the wolf and also the fox, but that's what is also called as dog tapeworm. And the larval stage or the metacystode is found in humans as well as other animals like sheep and goats and cattle. Okay. So now how it looks like, you can see the adult tapeworm. This is the adult form of Echinococcus granulosus. So again, the scolex is there. There is a neck, and there is like the strobila or the body, and you can see over here like there are suckers. Okay, so which are 4 in number. There are hooklets in 2 rows. Okay, which are there. So now the important thing is like you can see the body have 3 further divisions which are called as proglottids. So this is the immature proglottid, this is the mature proglottid, and this is the gravid proglottid. Like gravid proglottid means like it is the one which is containing the eggs. Okay. So of course, like this one is like much wider and much longer, you can see with than the rest of the worm. Why? Because this one is filled with eggs. Okay, this one is filled with eggs. So this is how it looks like. Now the larval stage of this one, which is basically the one which is going to infect the humans, they are the one which is found in the hydatid cyst, which can develop in any organ of the intermediate host. So now if we will discuss the life cycle of Echinococcus granulosus. So the hydatid disease, it is caused by the infection with the larval stage, as I told you, metacystode, right? So you can see, like again, infective stage and diagnostic stage, they are written over here like this, okay? And the dogs or the fox and the wolves, they are the definitive hosts, and then there is intermediate hosts, which are the other animals, and it can also infect the humans, okay? So so it have 2 hosts to complete its life cycle. Okay, dogs or domestic dogs act as primary definitive host of the mature adult worm, and a single infected dog can have millions of adult worms within its intestines. And other animals like wild dogs, wolves, fox, jackals, they can also harbor the tapeworms, but like dogs are very common, so that's why I'm talking about the dogs. And if we will talk about the intermediate host, they can become infected with the larval form of a parasite, okay, which could be a sheep, a cattle, pigs, goats, or horses. And the life cycle is completed by the ingestion of 1 or more cysts and its contents by a canine host through the consumption of what? Infected viscera or infected organs of the sheep or other livestock. So now humans, they can become infected through the ingestion of the food or water which are contaminated with the eggs released from the feces of the dogs. Okay, so these infective eggs which are released in the feces of the dogs basically can enter in the humans, and once it is ingested, the eggs, they release oncospheres in the intestines. See, oncospheres released. Okay, so you can see, so adult and small intestine. I show you this thing, right? This stage, and this one have eggs. So see, this one is released. The eggs are taken by the humans. They ingest that. The eggs release oncospheres. Now these oncospheres which are released in the intestines, they can penetrate the intestines. So when they penetrate the intestines, and if you know, like the blood from the intestines goes where? It passes through the liver, the first important thing. So the oncospheres, they gain access to the blood via the hepatic portal vein, and then they can migrate to any internal organs where they form cysts. So they can form cysts in various organs like liver, like legs, like brain, like bones. Okay. So, but most common place is the liver because this is the first place the blood passes through. And after liver, the blood goes to the right heart, and from right heart it goes to the lungs. So, lungs being the second common place. Okay. So, see, the blood from the intestines go past to the liver, liver the first common place. After that, it goes to the right heart, and from right heart it goes to the lungs. Lungs is the second common place. Now, guys, important thing, remember this thing. Why don't affect the heart? Because in the heart the blood is not passing through the capillaries, but in the liver and in the lungs the blood is passing through the capillaries. But if it will escape, the circulation, of course, it can reach the bones, it can reach the brain, it can reach the skeletal muscles, it can reach the kidneys, it can reach anywhere. Okay, so you can see. Now, the sign and symptoms in humans depend upon the location, the size, the number of the cysts, which are present in the infected tissues. Okay. Now, I'm not going to discuss, we are not going to discuss Echinococcus multilocularis, uh, but that have almost the same cycle, like it requires two hosts. The primary host is a fox, okay, although it can also affect the cats and the dogs, but like they have a little different story. So you can see over here the definitive host, which is a dog, and the intermediate host, which is sheep and the cattle. Okay, and man, they are basically a accidental host, you can say, or you can say a accidental intermediate host. Okay, so now um, you can see over here, if you read like adult and small intestine, embryonated eggs in the feces, oncospheres, hatches, penetrates the small, like the intestinal wall, hydatid cyst in various organs, commonly liver and lungs, and then they develop into protoscolex from cyst, and the scolex attached to the intestines, and it develops into the adult, and again they release eggs. So this is how it completes the life cycle. So again, immunity, guys, immunity is very important because whenever like we are going to adjust this one, uh, we divide the immunological stage into two stages. Like one is called as pre-encystment phase, and the one is called as post-encystment phase. So both the cellular as well as the humoral immunity, uh, they play a role in both these phases. For example, whenever like anyone is infected with Echinococcus granulosus, the cell-mediated type of immune reaction occurs against the parasite, and like the oncospheres which are released. Okay, uh, like the leukocytes, they increase in the number, or you can say leukocytosis occurs. Okay, and the host complement system also become activated, and that's why like the host, the humans, they they give inflammatory response type of reaction. Okay, and they started killing the parasite, and a lot of things are also released from the parasites which uh, participate in giving the clinical signs and symptoms. And then IgG, IgA, IgM, they started producing antibodies, and of course, like antibody dependent cell mediated cytotoxic type of killing starts. Okay, so once the cyst is formed, so uh, there is increase in IgM, IgG, and IgE in the body, and you will found like remember you will found like eosinophils, neutrophils, and macrophages in the blood. Cytokines are also released, interleukins are released, and all these things. So of course, like all these things are important. So first of all, I will talk about the clinical features, and in the clinical features, of course, I will be talking about the cyst, how it looks like. Okay, so uh, I don't say sign and symptoms, rather I use the word clinical symptoms because that makes more sense. Okay, uh, so talking about the clinical features, guys, uh, clinical features of this condition. So both of them, multinuclearis or Echinococcus, they are two species of the same genus simply, and both of them they causes human hydatid disease. Uh, but Echinococcus granulosus is more common, so that's why you can say 95% of the cases are by Echinococcus granulosus, so that's why that is important, and it affects the people of all ages. Uh, but cysts are formed more in, you can say, young people, like around 15 to 35 years of age. So what happens, like, of course, like depending on like where the cyst is developing, it's in the liver, it's in the lungs, or XYZ, any other place. As I told you, most common place is the liver, and the second most common is the lungs. Okay, and the cyst can survive for several years without causing any sign or symptoms. So remember, the first most important thing is asymptomatic. Many of the people, they are asymptomatic. They have the cyst which cannot cause any sign on or symptoms for years and years. Okay, so when the cyst become enlarged, or what you can say too much large, like there could be abdominal swelling because the cyst is very much enlarged, and you can say that this is the time when you can palpate or palpate the cyst or the liver, because the liver is enlarged. I'm talking about liver, but of course, like any part of the body. So abdominal swelling is there, and the patients may have abdominal pain. Okay, especially in the right upper quadrant. Right upper quadrant is the place where there is liver. So this is how they present. They can present with nausea. They can present with vomiting, which are very, very, very common symptoms. And some of the patients, the cyst can also rupture, and once they rupture, it results into anaphylactic reaction. Now again, I am not sure because I'm not in front of you. So if you don't know what is anaphylactic reaction or anaphylactic shock, guys, please go through that, okay, and understand what is that. Uh, Many of these cysts, they can cause problem with the biliary tracts, or you can say like they can result into the biliary tract disease. It can also cause portal hypertension or increase in blood pressure, in the portal circulation. And whenever it is related to the cyst is in the lung, so we call it as pulmonary uh, cystic echino, echinococcosis. Okay, echinococcosis. So, uh, of course, like in that case, pulmonary signs will be there. So, whenever the cyst is in the lungs, it can be silent again for many years, you can say, or for a long time without any symptoms. But when the cyst, it keep on growing in size and it started blocking the bronchus, then the patient may have like symptoms like dry cough, okay, or chest pain, or hemoptysis. Hemoptysis you have done, right? Hemoptysis, so blood in the sputum. So this is how these patients present, okay. And one of the things is also called as alveolar echinococcosis, okay, alveolar echinococcosis. So now, why I'm talking about this one? Because remember, this one is caused by Echinococcus multilocularis. Okay, this one is not caused by Echinococcus granulosus. And what happens? Like they have a formation of multilocular hydatid cysts, which contain little or no fluid, and these cysts, they don't have hyaline membrane, and simply uh, it can cause tissue necrosis, and many people, they can die because of this thing. And of course, like rest, there could be any symptoms, like if they can affect the bones, okay, they can affect the CNS, they can affect of course the kidneys, okay. That's what's my point is, like it can go anywhere. It can go to the muscles, it can go to the eyes, it can go to the spleen, etc, 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 okay. So of course, like depending on which area that the thing is, of course, like they will present in that way. Okay, so you can see over here, like basically it is a microscopy of a hydatid cyst, right? Like this one which you are saying, and like this is one is like the typical look of the liver, and what they found in that patient, okay. So what happens is, you can see over here, there is something called as brood capsule, there is hooklets, there is endocyst, there is ectocyst, there is pericyst, which is the outer one, and this was the liver tissue, okay. So if you can found like here, uh, basically whenever this cyst is there in the liver, you can see over here, right? So it enlarges slowly and reaches like the diameter of around 1 centimeter in about 6 months, okay. And the cyst wall is secreted by embryo, and we can see like the three layers. This is the pericyst, this is the outermost layer, and it is formed by the inflammatory reaction from the host, okay, like eosinophils, giant cells, and all this one. They are the one which form this pericyst. And then there is ectocyst here, which is the intermediate layer. Again, this is made up of laminated hyaline material, and the appearance of this one is exactly like the boiled egg white part. And this is the endocyst, the inner part, and this is like the germinal layer, which is cellular, and it consists of number of nuclei, you can see over here, right? And they have shown you what you can say here as well, okay. And then there is the fluid here inside, which is called as the hydrated fluid. It is clear fluid, you can see over here the clear fluid. It is a clear fluid, it is called as the hydrated fluid. It is, okay. And inside there is this one, brood capsules, okay. which is present inside. Okay, so now we have discussed the clinical features. So now I think you understand the idea, because I, like, for example, if someone have an infection in CNS, they will present with seizures. So maybe someone have the infection in the kidney, so maybe they will have hematuria or the blood in the urine, right? So how we diagnose these patients? Okay, so now the diagnosis again. Uh, the proper diagnosis and treatment of hydatid cyst disease is difficult, because the individuals, they remain asymptomatic for several years after initial infection. Uh, and in that time, of course, there is like the cyst becomes so large. Okay, so of course, in that case, we go for imagings. Okay, so you can see over here imagings. Imagings. What imagings can be used? Ultrasonography can be used, and this is the procedure of choice. Why? Because widely available and it's simple to do, right? CT scan can be done, MRI can be done, X-ray can be done, IV pyelogram in the case of renal cyst can be done as well. Of course, like depending on where the cyst, we will examine that one. You can take a fluid from within the cyst and you can examine that fluid, and of course, like when you will do that, you will found brood capsules, you will found hooklets, like all the things which we were discussing. You will found that clear fluid which is inside there. Uh, Cassoni's test, which is a hypersensitivity type of reaction, type 1 type of reaction, by the way. So, uh, so what they do, like, by the way, they collect the hydrated fluid from the animals or the humans, okay, and this fluid, they inject in the arm of the patient, and they see like if there is any reaction on the skin or not, okay, and if there is any reaction on the skin, so of course, like the patient have uh, that thing. But this test is not done nowadays, guys. Obsolete, because now we have a lot of diagnostic tests which we can do quickly. So this one is an old test, which was defined in 1911 by a guy named as Cassoni's, and nowadays it is not done at all. So nowadays we have serological tests, we have imagings. At that time, we don't have these things. So serological tests, of course, like we can detect the antibodies in the serum. Again, by ELISA, by indirect hemoagglutinin, IHA. Okay, complement fixation testing. So we can detect the antigen, or we can detect the antibodies, right? So like these tests are widely available nowadays, and others, like we can like these are the patients, because they have, remember, whenever the parasitic infections are there, the eosinophils get raised in the body. DNA, PCR, all these things can be done. So nowadays, CT scans and MRIs, they are used too much in the clinical settings, okay, and they are useful in detecting uh, the cyst. And like when we do these investigations, simply typical features of the cyst can be seen, including the germinal membranes, internal septa, daughter cyst, which is inside the main cyst. And of course, we can go for serological tests, but not Cassoni's test simply. Okay. EITB again can be used. What is CIE? P, I think. Here it is like written. I think like they made a small mistake in this book, or maybe I am at mistake. But what I remember, it is counter. It is counter current electrophoresis, so that should be P, not. Maybe we can see electronic. Okay, okay, this one cardiac implantable electronic device. Okay, I am really not sure like what they're talking about. So anyhow, there is some test called a CIEP, like which is counter current immunoelectrophoresis, right, which can be done. So that thing. Now you can see the imagings, like the guy, like they are showing you over here, different imagings, right, taken from the patients who have this condition. Okay, so you can see like see on CT scan you can see a big hydrated cyst inside the liver, or you can see it is in the lung lobe. Okay, again X-ray shows in the right lower lung, like all these things. There is a big cyst which can be seen here. So guys, like after that, like we we must go for the treatment options which are available. So treatment. Now this is the condition which the main treatment should not be medical, rather surgical. So surgery is the treatment of choice, of course, okay, in these patients, because of course we have to remove the cyst, right? So patients which are diagnosed with multiple cysts often require staged surgeries, or you can say not one surgery, right, rather 2 or 3 surgeries, and complete excision of the cyst is difficult. Okay, so of course, like because it's very hard to explore all these things. So, and when they are doing surgery, like many times, the cyst can rupture, and the cyst fluid can be spilled inside the body cavity while doing surgery, which can lead to, you can say, the spread of the infection inside the body during the surgery. Again, the drug which we use is albendazole, as I told you, very important drug. It is frequently used in the patient with hydatid disease, and the treatment again takes a long time, around 1 to 6 months. Okay, so we can do this thing. Nowadays, a new type of thing is available which is called as PAIR. So what is PAIR? It is percutaneous. Like PAIR is basically puncture, aspiration, injection, and re-aspiration. So what they do, by the way, in this one, they reach to the cyst under the guidance of the ultrasound to guide the needle where it is going. Okay, and once they reach there, they puncture it by that needle. They take out the fluid from that needle, and then they inject a scolicidal, you can say. Scolicidal. What is scolicidal? Scolicidal agent. Scoli, scolicidal. Like insecticidal, which kill the insect. So scolicidal is something which is going to kill those scolices, right? So 95% ethanol can be used, or hypotonic saline can be used. So they inject this solution, scolicidal solution, in that, and then again they aspirate the thing again. Okay, like just to make sure like the thing is killed. Okay, and there should be no spillage. Okay, you can say one more thing which is used nowadays, because nowadays many of the, what you can say, minimal invasive surgery techniques are there. So percutaneous aspiration can be done. So what is percutaneous aspiration? Nowadays, like by the help of syringes, they can aspirate the things. Okay, so injection of a scolicidal thing in the so alcohol can be used, as I told you, hypotonic saline can be used, and there are many other things which can be used, but that's not an important thing. So this is how we treat this thing. Okay. And so, reoccurrence is very common, guys. Many times, it can reoccur, and so that's why you can say they keep on examining the patient time by time. And what you can say, if they found like any reinfection, of course, like they treat that. So how we can prevent, again, like the same thing which I told you, like prevention can be done by what ways? Again, uh, livestock. Okay. Uh, like in this one, livestock care should be done. Okay. Educate the people, again, to prevent the feeding of infected organs to the dogs. Okay. If you remember from that circle, like the dogs can get infected when they consume the organs of the infected animals. And the people who have dogs in the home, what they do, like they give them the liver of the sheep, the heart of the sheep, the kidney of the sheep, things like this. Okay. So of course, if you will reduce the infection in the dogs, you will reduce the infection in the humans. Okay. So of course, like control of stray dogs, which are in many countries, like this is a big thing, or unwanted dogs. Like in China, I never see a stray dog, but in many countries, I can see the stray dogs. Okay, or you can also treat the dogs with anti-parasitic drugs like albendazole, but of course, like not so important. So this thing is important, right? Like this is how we can prevent this condition. And of course, like personal hygiene comes the most important thing, like wash your hands time by time. Okay. So I hope you understand this condition, guys. This hydatid disease is important. It affects millions, and that's the reason it have attracted a lot of attention of the medical or public health workers. And like of course, like there is not like uh, these kind of conditions could be controlled easily, like if we are going to maintain these things, of course. So thank you so much for listening. I will see you around.